Kelly, how are you today?
I'm fine. How are you?
Good, thank you. My name's Kelsey. I'm the nurse. I'm going to get your vital signs and ask you a couple questions before the doctor comes in and sees you, okay?
Okay.
Okay. I'm going to perform my hand hygiene. And apply my gloves. At this point, I'm going to check the patient's chart and then ask them to verify their identification. So, Kelly, can you please tell me your full name and date of birth before we get started?
Kelly C. Duncan, 4/19/1971.
Perfect, thank you. Okay, so I'm going to start off by getting a blood pressure on you. What I'm first going to do is I'm going to palpate for your brachial pulse, okay?
Okay.
It's going to be a couple inches above the bend of the elbow. Have you had any mastectomies? Do you have any stents or a fistula? Is there any reason that I need to take blood pressure on one arm or the other?
No.
Okay, perfect. So I'm going to palpate for the brachial pulse. Sometimes it's hard to find, which is okay. We just need to know if we can find it or not. This one is palpable. I'm going to come right on over here. They're both palpable, so I'm going to give them both a +2 and write down that I can find brachial pulses bilaterally. Next, I'm going to come right down here with 2 to 3 fingers to the radial pulse, which you can find on the thumb side, and apply moderate pressure. I found this one very easily. It's a very strong pulse. Come right over here and do the same thing. I found both of them very quickly. I'm going to also give them a +2 and say that I can palpate radial pulses bilaterally on patient. So before I get an actual blood pressure, I'm going to come over and I'm going to find the systolic threshold. To do that, I'm going to take my blood pressure cuff and I'm going to find the indicator. I'm going on the left arm, on the right arm, and I'm going to line it up with the brachial artery. The best case scenario, I would have this patient's arm at heart level and it would be rested on a table outright, but we're just working with the area that we have. So I'm going to find the radial pulse again. And all I'm going to do is pump up the blood pressure cuff until the radial pulse is cut off. Okay, so at 130 millimeters of mercury per mercury, it cut off. So I know that I just need to do it 30 millimeters above that, and that'll be a nice place to stop, so I'm not overly cutting off the circulation of the patient's arm. I'm just going to adjust this one more time, just to be adequate. Going to get my stethoscope. Bring it right up here. Perfect. Can you rest your arm for me, please? And I'm going to listen for the lub dub. So I'm going to pump this up to about 160 millimeters per mercury. And gently let it go. I got 124/68, which is a nice healthy range for the blood pressure to be in. Okay. Next, I'm going to take my pulse oximeter. It's going to measure the oxygen saturation of the blood, and it'll also measure the heart rate. I'll clean it off with my alcohol wipe here. Dispose of the alcohol wipe and place it on the patient's middle finger. So Kelly, this is going to measure your heart rate and your oxygen saturation levels, okay? So while you're doing that, I'm going to take my temporal thermometer and slide it along the patient's forehead. And I got 98.2. which is a nice temperature. It's not quite a fever. It's in the normal range that we want it to be in. Oxygen saturation reads 96% and pulse reads 84. I'll also have to palpate pulse, but this will give me something to compare it to make sure, or just check the accuracy of my manual counting. So 84 and 96, perfect, thank you, Kelly. So I'm gonna come here, find the radial pulse, and I'm gonna count them for a full minute. Awesome. I got 85, which tells me that my pulse oximeter is probably pretty accurate because that gave me a reading of 84. So now I'm going to do respirations. So I'm going to also have the patient sit there. I'm going to watch the chest rise and fall. How you doing today, Kelly?
Okay.
Good. Good. Have you had a good week?
Not really.
No? Can you tell me about it? Anything that we can help you with today or anything that brought you in today?
Sinus congestion and headaches.
Okay. Okay, good. We'll dive into that right here in a minute. I got 14. So 14 is good. You want an adult's respiration rate to be anywhere between 12 and 20. You also, I don't know how to do it in this video, but you also want to try to not make it as obvious that you're reading the person's respirations because they often have a tendency to change the way that they normally breathe when they know that you're watching them. So, okay, Kelly, so we're going to move into your assessment, okay?
Yes.
Perfect. Okay. So can you tell me a little bit about what brought you in today?
Sinus congestion and headaches.
Sinus congestion and headaches. Okay. Okay. Can you tell me when you first noticed the sinus congestion?
About 2 weeks ago.
Ago. Okay. And have you done or noticed anything that makes this pain better or worse, or the sinus congestion better or worse?
It's worse at night.
Worse at night.
I also have a slight cough and some postnasal drip. I think that's why I'm coughing. Because otherwise I don't cough.
Slight cough. So, with the congestion, is the cough congested? Is it phlegmy?
Yes.
It's a phlegmy cough. Can you tell? Do you know the color of your phlegm?
Kind of greenish yellow.
It has got a color to it. Okay, green yellow phlegm.
It's thick.
Okay, and nothing makes it better or worse?
No, I just cough it up a little bit and then I'm better. I don't cough all day, just every now and then.
Okay. Is it affecting you?
Yeah, I can't sleep very well at night.
Okay. Can't sleep because of that. Okay, so can you describe the pain to me, or can you describe, so you said congested, but you also mentioned a headache. So is it a dull headache? Is it a persistent headache?
On and off
It's a
right
sharp?
here in the front, or just a dull aching headache.
A dull aching headache along with sinus congestion and cough. And you said in the middle, it's a middle headache,
My frontal headache.
middle frontal. Okay, perfect. So is it anywhere other than your head, or is there anything else?
Right here in my sinuses.
So just the
underneath my
sinuses
eyes.
and chest, throat at all?
No sore throat.
Okay.
I have to wear a mask at work all day, and that makes it worse too. Because I'm a nurse and we have to wear a mask all day.
Now, have you been tested for COVID?
Yeah, I've been screened as was negative, so I don't really meet the criteria for COVID, but just to be on the safe side, I got tested
Okay. How long ago were you tested?
about a week ago.
Okay. So on a scale of 1 to 10, 0 being no pain at all, and 10 being the worst pain you've ever felt, can you describe what you're dealing with right now?
Just about a 4, and I
4.
take Tylenol, 2 extra strength, and it usually takes care of it.
Okay, so
And I also
taken
been-
over the counters.
Mhm.
Extra strength. You said 2 a day, 2 just each time it.
2 each time I have a headache, so sometimes once a day, sometimes twice.
Okay.
And I take NyQuil at nighttime.
Okay, and then you said that it's been going on for about 2 weeks. Has it gotten better at all, or it's just
Gotten worse.
worsening over the last 2 weeks?
I thought it was from the weather change and the mask, but I think between it all, and I'm now.
Now it's staying nice and it's still like that.
Mm-hmm.
Okay. Is there anything else that you want to let us know today? Do you have any history of sinus infections
I
or
do.
sinus? You do. Just
Ever
with you
since
or
I was a child.
your family or just you?
Just me.
Okay. History of sinus infections.
Yeah, and I usually take Keflex,
You take Keflex. Okay. Are
and
there
that usually works for me.
Are there any medications that you're allergic to?
Penicillin,
Okay.
and that is in hives. I get that.
You get hives with the penicillin?
Mm-hmm.
Okay.
Yeah, and I went into anaphylactic shock as a child with that, so I can't have penicillin.
Okay.
And then Bactrim, which is sulfa, gave me really, really bad hives, so I'm allergic to that too.
Bactrim as well. Okay. Okay, is there anything else that you want the doctor or me to know today before he comes in and evaluates you?
No.
Okay, honey. Okay, well, let me get this all in the computer. I'll put your vitals in there, and I'll put this information that we got today, and then just give us a few minutes and he'll be right in, okay?
Thank you.
Okay, thank you.